tech and innovation, and this is coming up in leaps and bounds in different sectors, and we'll be focusing on technology and its impact on the health sector. So we'll be talking about telehealth. It's pretty much important that we understand what is this that technology is bringing on board. How can we capitalize or tap into it to make the best of the scenarios that we have on board? Health is crucial. Health is key. We say health is wealth. So it's very, very important that you are healthy. I mean, imagine a scenario where, this could be hands-on, that you really do not have to physically go to the hospital to get some of these diagnoses that you'd want to go and get there, to get some of this medical information that you'd want to go and get there, seated somewhere in your living room or wherever it is that you are, the comfort of your couch, and you're getting all this information. It's pretty much interesting to even imagine. So that is how much technology is doing to us. And it's not just about technology. It is about the people who are taking up this challenge, trying to understand deeper how much we can tap into technology to get solutions to the problems that we face today. So today we'll be talking matters telehealth, and joining me for the same is Francis Osiemo, who's the director SASAdoctor. What about SASAdoctor is what we'll be learning today. So good morning, Francis. Good to have you.
Good morning.
Yes, and what about SASAdoctor?
SASAdoctor is a telehealth company. That's what I can say, is a telehealth company incorporated in Kenya as SASA Health Limited. And we have an application called SASAdoctor. It's both on Android and iOS, and we are also coming up with something else, is USSD for those people who are actually don't have per se a smartphone, because we want to cover virtually everyone. Because approximately, research has shown approximately 63 to 70% of the conditions that we go to outpatient for can be treated via telemedicine.
Right.
And telemedicine is just not about the video consult alone. You can do the video consult, which is really robust, which can give you up to 70%, but a phone call can give you up to 50%.
Yeah.
So if you're able to incorporate both, there is the voice, there is the video, and sometimes we're able to integrate devices. For instance, right now we are working on integrating some devices into our application, and those devices will be able to give us medical grade vital signs. With this medical grade vital signs, you are actually doing partly the physical examination that you need to do without the patient necessarily going to the hospital. So basically, you're covering the health of a person. And to be honest, right now with these issues of overcrowding, of the age of social distancing, you need to be able to do something remotely. Right. We are ordering online. We are doing everything online. We are just changing the way we live. With this, healthcare has been left behind for quite some time.
Right.
Telehealth has been around for more than 11 years, 12 years. Some other countries, let's look at Canada. Canada has had telehealth and incorporated it into their system for a very long time. And yes, it's worked really well. It has reduced their cost. They've been able to achieve a lot with this. Yeah. And where I'm going with this is with SASAdoctor, what we are trying to do, what we are passionate about is about affordability, quality, and convenience. Those three things are essential for healthcare, and that is the only way we can push the universal health coverage. So there is a lot that we are doing in the background to be able to achieve. Even we want to work with the government. In some instances, we've already started working with them partially. And in terms of universal health coverage, for instance, we are going, we have a partner clinic in Kisumu, Kakamega, not Kisumu. And in Kakamega, what we're doing, we are taking schools up. They have tablets in the schools, and then from there they're able to consult with the doctors. They're in everywhere, they're in Nairobi, wherever they will be. But basically they're able to consult a medical practitioner who is certified and you can verify. If you are able to download the application right away, you'll be able to see each practitioner, their registration number, etc., and you can go online and confirm that this is a legitimate practitioner.
Hold it right there. I am curious to understand the difference then between telehealth or the connection and telemedicine, or they're one and the same?
They're basically one and the same. However, when we talk telehealth, it's broad. Okay. Because we are looking at a relay of information in terms of if today I took your X-ray, maybe I'm just a radiographer. I'll take your X-ray, but I might not be able to read the X-ray. But with the DICOMs, I can send it to another person who is a radiologist to be able to interpret that. That is still telehealth. To interpret results, to interpret diagnostics, etc., or assist each other, because I might be, I'm a clinician, for instance. I want to consult with a pediatrician. I was seeing this child, for instance, and then I think this is something I cannot handle. I need an opinion of a pediatrician. I will call a pediatrician, and they will be able to guide so that we are able to finalize that consultation. That is basically what we also do in our practice. But that is still telehealth. Telehealth incorporates even those messages that you're getting for purposes of wellness. That is still telehealth. There's some people who will use telehealth to just do the monitoring and evaluation. So telehealth incorporates a lot, but telemedicine now is you focusing on the medical side. So and that is where we are at. But I'll tell you, SASAdoctor is a whole different level. It's combined telehealth. It's just telehealth, and then there is an option, or I don't want to call it an option, it's really part of us where we want to bring in affordability. So we have products, or subscription products, where people are able to subscribe and then get telehealth services or even health services, because we work with other insurance companies to be able to provide these services, so that somebody is able to get something that is end to end. Yeah, so basically that's the two differences.
All right, then I'd want to know how then does telemedicine come in to be incorporated on the aspect of healthcare? I know you have expounded, but I'd love for you to go an extra mile in that for the purposes of us understanding some more and why it is that maybe we should look in this direction.
So let's look at this perspective. And
the confidence that, it brings on board, because like you rightfully put it, or like, it is well known, health is crucial. And most of the people would want to gamble for as long as they are, safe and all that. But you can only gamble up to a certain level. And then you realize that maybe this is not working. You probably go back to the traditional style. You probably go back to the usual style that you used to.
So I'll tell you, there are a lot of people who Google diseases, for instance. But do they get the correct information?
Not always.
Most of the time, no. Unless you know how to look for information, you will not get the right information. And that is why there are so many companies out there that are trying to do all this to be able to deliver that healthcare, proper healthcare. This is, you're using a certified person. The idea is, I don't want to go and get somebody who's not certified on the platform.
On the platform.
So that is number one. So for instance, for us, we have a robust, a very rigorous process of onboarding our doctors. It's sometimes some of them drop out by saying that they're frustrated with the process because they have to meet certain criteria. And then in terms of us shifting towards telemedicine, number one, we are in the age where we don't want to acquire what we call nosocomial infections, hospital-acquired infections. So if I'm going to a facility today and I sit there, I don't know what the next person has. So if these condition can be treated via telemedicine. Telemedicine is not actually replacing the medicine. It's the same thing, it's just a different process.
Yep.
It's like you're not replacing a supermarket by purchasing anything online. You're just buying it from that same supermarket, but it's coming to you. So you're using actually the same doctors, because in some instances when you go to the doctor, they will just talk to you and then write your prescription.
Yeah.
It's the same thing, but now we're making it convenient where you don't have to queue. You don't have to go wait in the waiting bay. However, remember, we don't treat 100% of the conditions. So the part that you will be asked, even when you're using the application, you will see the prompts coming in and they will tell you, in some instances, telemedicine is not complete. You might be asked by the doctor to go for a physical examination. So you have to admit that. So that is one of the disclaimers that we have. So we don't treat 100% of the infections. We have a limit. And then the other thing, we have the e-health guidelines in Kenya. And we are actually following up, we are finalizing the HIPAA compliance. We'll be the first company to be HIPAA compliant in Kenya right now. But the e-health and m-health guidelines that is from the Ministry of Health say that we cannot practice emergency medicine on the application, on e-health platforms. So that, if it is an emergency, we might guide you, but we will not actually treat you. We might guide you. For instance, we have some organizations or insurance companies that we're working with, and they tell you, in case of an emergency, you just call us. So we'll keep the patient, because it's on video, we'll keep the patient there. We have called the insurance to dispatch, or the ambulance directly to dispatch an ambulance, and then you're reassuring the patient as they are transitioning to the inpatient through the ambulance. So that way you are able to assist that person to be able to get proper care. That is why the telemedicine way is the better way.
Well, you've given us the pros. Any cons in this case? And I hope you're genuine enough to tell it to us.
So yes, there are cons of using telemedicine. Sometimes you might miss out on something. You might miss out on something just because of, and this is majorly in the psychotherapy part, because we do a lot of mental health, to be honest. But the psychotherapy side, sometimes you might miss a few mannerisms, because somebody might change the video towards a different side while you actually wanted to see them with some questions that you've asked. We've seen people try to abuse the platforms, where they come and they want to get what we call controlled substances. And these controlled substances, we don't actually ourselves, we don't prescribe. But usually what happens is we get a backlash when some of the people will go to the Play Store and say, this is a crappy app, blah, blah, blah. And to be honest, it's okay. We can never get 100%. Yes, there are cons, and apart from that, there has been a big problem in getting the vital signs, medical grade vital signs, because you know the fit bands, etc. They don't give us what we call medical grade vital signs. We've tried to integrate some of them. We've tried the pulse, the BP, all that, but it's not worked. Right now, we have another company that we have worked with, and now we are finalizing. We actually got the certification ISO C and FDA approval just recently. Now we just want to finalize, and with the schools that we're working in Western Kenya right now, we are going to put those devices there. And if somebody needs that device, we'll be able to loan it to them. For instance, for the COVID patients and all that, we actually loan it to them, because we are getting all the vital signs, because we have a monitoring program where they are supposed to be seen 3 times in a day, etc., etc. There are so many things that we've incorporated into that, so that we are able to get medical grade vital signs which we will use to be able to make a decision.
All right.
And that is really one of the biggest challenges of telemedicine.
Well, data protection is pretty much crucial in this particular case. I'm just curious, and I would want to believe anybody else at home would be, just how much is their information, health information for that matter? We all know that sometimes we like it private, and sometimes that is what is actually proposed. So how much protected, or what level of protection is there for one's medical reports and records and information and data and all that?
So first I'll tell you, our application is different.
It's just to direct you?
No. Our application is complete.
Okay.
We're actually giving the medical record to the patient.
Okay.
The patient is not going to go to any facility to ask for the record.
Right.
The moment you've seen a doctor, all your record go into your medical record. What we've done in the background, we've used very high encryption methods to be able to protect the data. And this one has even been proved by HIPAA themselves. They've checked that.
Okay.
But the loops, where we usually have the loops, is the human resource part. If your staff are not professional enough, they will be able to leak information. But that is why we take professional indemnity. Yes? So the only part that we know is a problem is the patient's part.
Right.
But right now, we've made sure that after 2 or 3 hours, if you log into our account, it will automatically log you out. So somebody else will not be able to log in. So you have your password, and we use the best standard practice of encryption, that is for the password. And you can also use your fingerprint. For those people who use face recognition, they can use that. And when you're going through the process of consultation, for us to make sure that you are the person you say you are, we use facial recognition in the background to ensure that we are giving healthcare to you. So if somebody else comes and takes your phone, and maybe you had logged in and you hadn't logged out, and they want to use your medical, for instance, especially, this is even to prevent fraud, to prevent data pilferage. The moment they come on the video, they try to go onto the video, they will have to take a selfie.
Which will?
And then that has to be matched in the background with what we have in record. And the moment, if that goes through, if they are on the video, the doctor is able to see there is the profile picture, there is the ID photo, and the photo that that person has taken.
Right.
Are they matching before they actually start seeing you?
Okay.
So those are different levels of protection. And then the last one, we enable remote errors.
Okay.
So if today you lose your device and you report you've lost your device, somebody will not be able to access your medical data unless you are the one, as the patient, sharing the medical data to somebody else. So data protection is really vital. You cannot afford to run a telemedicine company without data protection, because this is somebody can easily extort you, because they will take the medical record and then they will say, we will leak this unless you pay this ransom. So it's really vital for us to be able to protect the data of our clients. We've protected the data of our clients, and they have direct access to their data. And in the cloud, it is actually fragmented, and the storage is safe. We have our servers within Kenya and outside Kenya, and we've actually made sure that they communicate with each other. But if they are not communicating, if the loop is not complete, then you're not able to access them.
Amazing. So towards the last minutes, and you mentioned something to do with universal health coverage and working with the government. In most cases, it's very crucial to get that support from the government, and very crucial to also work in tandem with them. So just how much is telemedicine or telehealth care coming in, and how then does it tie with that goal to achieve universal health coverage? I mean, which is something that has really been a toll.
So for universal health coverage, we are a social entrepreneurship project. We are not really for profit. We just need to break even. So with social entrepreneurship, you don't really need to make these huge profits. So for us, what we've done is we want to demonstrate to the government. We've gone to the government, we've shown them what we can be able to do.
Yeah.
We've done something with the Juakalis, Kariobangi, we have a clinic there, and Kibera, Ngong, Kamkunji, all those places, we've done something, yeah? And we've been able to demonstrate how we can go low. And with this, because of the numbers, it's easy.
Yeah.
Right now, we are doing something with the schools. And with these schools, we'll be able to demonstrate further to the government.
Right.
And what we are saying, we just need that chance to be able to demonstrate. We've not asked for a lot of financial support. We've just gone in and doing it ourselves,
right,
and showing it to them that we can be able to use telehealth to be able to achieve universal health coverage.
Yeah.
Secondly, the cost of getting, for instance, a consultant. For instance, for us, consultants are there even at night sometimes. So some of them work in other places, but they will be available.
Yeah.
In that person who's in the remote area will be able to access a consultant who's in Nairobi without necessarily traveling.
Yeah.
That is a component of universal health coverage, because
Right.
you're giving, yes, the basic, but you'll be able to give a multi-level, because the healthcare is multidisciplinary. You cannot depend on one thing, on one person. So it's multidisciplinary. So that element of referral system is working well because of the use of telehealth. And lastly, because you've seen, we have an iOS app, we have an Android app, we now have USSD. It's almost rolling out in maybe a week's time. We'll be rolling out the USSD platform.
Yeah.
And this will enable anyone in Kenya, as long as you have any phone, to be able to go in and talk to a doctor, a professional doctor, somebody you can trust from the other end. It's not like you're walking into a clinic that you don't have the knowledge about. You can check those practitioners who are on those platforms. So then when you go to things like mental and nutrition health, people assume like those are not really important sometimes.
They're very crucial, especially
they're very,
now.
Yes, they're very crucial. And this way you are able to access them directly. You don't have to look for them. Sometimes it's very difficult to get a nutrition clinic.
Right.
But in this instance, you just go into the application and you're able to see the doctor right away. You see their qualifications. If I want a nutritionist, if I want a counselor, if I want a psychiatrist, if I want a pediatrician, if I want a gynecologist, I'm able to go direct to the point. If I just want a general practitioner, we have general practitioners who are clinical officers.
Yeah.
We have medical officers. We have medical officers who are general practitioners.
Yeah.
And then we have specialist clinic officers. All those are there. And you will see who you are actually selecting.
Right.
Yes.
Okay, that's incredible and indeed worth checking. On Play Store, you go and download?
Yeah, you go SASAdoctor. SASAdoctor. It's just one name, SASAdoctor. We usually the Sasa is capital and then doctor is small. But all as one name. We will be releasing the USSD. We're just confirming we'll be able to give that code out. Currently, I don't want to give that out. But for both Android and iOS is SASAdoctor. We're actually changing the face of the application. We've had this for more than 2 years. Actually, we'll be 2 years in
the market.
In the market tomorrow.
Oh, nice! Happy birthday!
We actually launched this application on the 5th of November 2018.
It was great having you here today. As you march into your second year in this business, which is incredible, so to speak. And of course, if you're able to access health at the comfort of your home, I mean, honestly, genuinely, the few of us who've had struggles with this, in the middle of the night, you do not know what to do, would probably resonate with what it is that is being brought by this incredible application. How about you? Check it out. Thank you so much, Francis Osiemo, Director, SASAdoctor. That's where we get to wind up this session or this segment. tech and innovation. And for that matter, we've extended it to the aspect of health. My name is Linda Alela. It was great having you from the word go up until now. I see you later in the afternoon as we take a look at the news stories of the day.